You write about this in your latest piece about health reform, how the White House essentially sat down with Big Pharma, Big Insurance, and the American Medical Association. I'm simply wondering if these deals that have been set up essentially limit the capability of the American people to benefit. Everybody else seems to be benefiting. Big Pharma is going to do great here. Big Insurance is going to do great. The AMA, fantastic. The American people, kind of screwed, really.
Well, Jack, this is what it's come down to. I mean, the bills that are now emerging from Congress, they do provide more coverage to more Americans, and that's a damn good thing. They also prevent insurance companies from saying to somebody, you cannot get insurance because of a pre-existing condition, and that's a good thing. But what they do not do is control the extraordinary increase in health care costs, and we're all going to be paying like mad for that. Why don't they control the increase in health care costs? Essentially because we have, that is, the administration and Congress has paid off the big pharmaceutical companies and the big insurance companies and the AMA in order to get their cooperation and their support for the legislation. And those payoffs mean essentially billions and tens of billions of dollars that you and I and others are going to be paying in the future that we otherwise would not have to pay.
But would we have been better off to take the billions that we essentially landed in the laps of these organizations like Big Pharma, Big Insurance, and the AMA, and took that money and spend it someplace else for the American people? Wouldn't it have been better for everybody involved? Or, well, wait, let me rephrase that. Wouldn't it have been better for the American people rather than Big Pharma, Big Insurance, and American Medical Association?
Well, that's exactly the question. What the White House and others will say, and members of Congress who have stuck to the deal, is we couldn't get anything if we didn't make these deals, if we didn't give them sort of hush money, if we didn't allow them to extort all of this money from all of us in the future in terms of our premiums, deductibles, co-payments, and taxes, because they would have blocked any kind of reform at all, as they did in 1994. So essentially what happened in January and February was that Big Pharma and Big Insurance and the AMA went to the White House, went to Max Baucus at the Senate Finance Committee and others, and said, look, if you want us to be quiet, if you want us to support health care legislation, if you want any prayer of getting this through Congress, you have got to make sure that we come out big winners at the end. And that was the deal, kind of Faustian bargain.
But
what it means is we're all, we all pay more.
Yeah, but I mean, what's the benefit to that? If the Democrats have a strong majority in the House and they have 60 members in the Senate and they have the White House, why do you turn around from the very beginning and say, here's what we're going to do in the negotiation process? I'll tell you what, we're going to give up the public option. I mean, a real public option, which said anybody could go to this government program rather than just we'll have it available. That was gone. How about single payer? Gone. That never even mentioned. And we sort of chip away till by the time this thing is over, we have a system that is a failure and really expensive and in the laps of the middle class. I don't understand how we get here and say, congratulations.
It's simple. Go back. The answer is 1994. The answer is found in the extraordinary wave of opposition, including television ads and radio ads and everything else, that the AMA, Big Pharma, and the insurance companies created to Clinton's plan. Now, I'm not arguing that Clinton's plan was a great deal, or it was better than today's plan, or was worse than today's plan. But the point is that they showed, the private companies, the private sector showed, the medical industrial complex displayed its power to stop any kind of reform. And so when it came to 2008 and 2009 and a new president, a new administration, Democrats in Congress, the medical industrial complex was able to come and say, look, if you want us to accede and agree and support and basically even be quiet, if you want any prayer of getting any kind of health care through, you know what we can do. You saw it in 1994. And if you want us to cooperate with you and not do what we did in 1994, you've got to pay us off.
How stupid are the American people, at least from the perspective of the medical industrial complex? I mean, how stupid?
Well, it's not about, Jack, it's not a matter of stupidity. The Americans are very smart. The problem is we do watch advertising, and we believe, essentially, it's like the big lie. I mean, it's like George Orwell. If the What happened in 1994 was that the medical industrial complex scared the bejesus out of a lot of Americans because they convinced a lot of Americans that healthcare reform would take away their choice of doctor. And look, the power of money to create a kind of demagogic fears in the media. And scare enough people that they tell their members of Congress we don't want something or we are fearful of something. Never underestimate that. Even with the support or at least hushing of the pharmaceutical companies, the insurance companies, and the AMA, we still had a lot of demagoguery, death panels and all the rest. Can you imagine if the AMA and the insurance companies and the big pharma had been supporting all of that demagoguery as well? I'm not justifying it, Jack. I think it's outrageous. I'm trying to explain it. I'm just saying that this is what I think was in the minds of the Democratic leadership in the White House when they essentially agreed to all of these provisions that would jack up costs.
Extraordinary. Robert Reich, former Secretary of Labor, professor at Cal Berkeley. Mr. Secretary, thank you very much for joining me.
Well, thank you, Jack. Bye-bye.
A real pleasure.